Today we've got the third annual symposium of the Centre for Patient Safety and Service Quality at Imperial. We've got more than 120 delegates, a really great mixture of researchers, healthcare professionals and the public. I see the key objective for today as being getting people together to talk about collaboration, to talk about implementing research into practice and to take forwards new directions in patient safety research. Patient safety is a really hot topic at the moment amongst policymakers, amongst healthcare professionals and amongst individual patients and the public. So I think it's really important that we bring people together to talk about how we can make improvements in this area. The afternoon was started off with an introduction by Professor the Lord Aradazi. He's the director of the centre and he introduced the event and gave us a sense of why we're all here.
We've had a fantastic year, most of which is really celebrating the outputs of many of our researchers here.
The first presentation we had was from Alex Carter. He's one of the health economists doing research within the centre and he talked about the importance of doing economic evaluations of patient safety as well as measuring just their efficacy.
What we do is try to allocate those resources in an evidence-based way, doing various forms of economic analysis, and those analyses should reflect societal preferences.
A year or so ago we invited applications from healthcare professionals and from patients and the public to put forward ideas for solutions to tackle real-world patient safety problems. So we next heard about several of the winners of that funding in terms of the developments that they've done and how they were getting on with them.
The level of quality of all their proposals was so great, we pretty much funded everyone, which was great.
We've run 27 training sessions in the course of the year. A registrar who acted as the operator during a tamponade training session on the Wednesday, and on the Saturday found his first solo tamponade on call at about 2 o'clock in the morning, and said that without the training he would have been completely lost.
It's about improving the safety of patients who require their liquids to be thickened for medical reasons. So what's the problem? Well, thickened liquids are commonly prescribed to improve swallowing safety in patients who can't control liquids in their mouth or their throat.
Next, Yasmin Alabai-Brown interviewed Peter Beresford, who's the chair of Shaping Our Lives, which is an organisation that brings together various networks of service users and patients. And she interviewed him to find out his views on diversity and inclusion.
More and more we seem to be socialised in ways which limit who we get to know, who we feel comfortable with. I think that's been happening very much with the kind of social revolutions that have been taking place in recent years.
We then had a debate around a motion about this House believes that patients should not be involved in the safety of their healthcare.
If we were getting on an airplane, the pilot takes responsibility and the aircrew for our safety. Okay? Of course, if we get up and do something stupid and compromise the safety of the aircraft, we're taking out of their hands.
And so the patient here was the last line of defence, and because she took responsibility, she is able to protect herself from harm.
We've got 24 posters here today. We've got submissions from researchers within our own centre, but also from many of the other delegates. And people here have got the opportunity to view those over coffee and to do some networking. The afternoon finished with a keynote presentation from Sir Bruce Keogh, Medical Director of NHS England, talking about some of the policy issues and the importance of patient safety research at all levels within healthcare.
Your chance of dying for equivalent severity of illness at the weekend was about double that of during the week. So it was quite significant. The other thing that came out was that our sicker patients were being admitted at the weekends. We don't know why.
I'm very optimistic for the future for patient safety research. I think a key is getting the right people together, and I hope that today will lead to future collaborations and research and true involvement of patients and the public in our work.